Thank you for joining us today for Meaningful Use Made Easy, a step-by-step approach to Stage 1 compliance. My name is Denise Ramos, and today we will be going over Stage 1 of Meaningful Use. We'll be going over all 25 objectives and how to achieve them using My Vision Express. I will also be showing you our Meaningful Use wizard and our checklist, which you will find within the examination. Now, in order to have this feature, you would need to be on the latest build, which would be September 3rd, 2012. So make sure you do that. We'll start off with what is meaningful use. Meaningful use refers to the application of certified EHR technology to your practice to comply with a series of measurable objectives. These include using EPrescribe, using EHR technology for electronic exchange of health information, and using EHR technology to submit clinical quality and other measures. You must comply with certain objectives in 3 stages. During Stage 1, which will be the focus of our webinar today, you must comply with 20 objectives. 15 will come from a course set, plus 5 that you must select from a menu set of 10 objectives. Now, out of these 25 measures, 9 will require a yes or no answer when you attest, and 16 are numerator and denominator based. Now, in addition, you must attest to 6 clinical quality measures. When you attest, it will be numerator and denominator based as well. The reporting period will be for the first year, which will be this year, 2012, 90 days minimum. After that, you'll have to do meaningful use for the entire year. As far as the incentive, what do you get back after meaningful use? It's 75% of what you bill Medicare. So in order to get the maximum, which is $18,000, you would have to bill $24,000. Now the penalties, and this is starting 2015, it's 1% to 3% of Medicare, and then after 2018, it'll be 3 to 5%. Now, of course, this does not apply to Medicaid because there are no payment reductions, and the payments are a fixed amount each year, which will remain constant as long as you meet all the eligibility requirements for program participation. Eligible doctors are, for Medicare, doctors of optometry. For Medicaid, they are physicians, primarily doctors of medicine. Now, as far as Medicaid and doctors of optometry, there are only 5 states that are offering for the Medicaid EHR incentive. Those states are Alabama, Illinois, Kentucky, Ohio, and South Carolina. When you register, you will need an individual NPI number, a user account with NPPES. You also must enroll with PICOS. So there are links here so that you may be registered for those if you have not done so already. The first objective that we'll be going over is core objective number 1, CPOE for medication orders. Now this is an objective that you should be getting 100% on. Anytime that you are prescribing a medication, whether it's through My Vision Express or EPrescribe, you should be getting 100%. It will count towards the numerator and the denominator. Any form of computerized provider order entry for medications will be satisfying this objective. You do only have to complete 30% of all unique patients, and there is an exclusion. So if you happen to write less than 100 prescriptions, you may exclude yourself from this objective. Core objective number 2, drug interaction checks. Now, if you have signed up with EPrescribe, then you are satisfying this objective as well. There is no exclusion to this, so for those doctors who are asking, do I need EPrescribe? Unfortunately, you do. Even though you write less than 100 prescriptions, for this objective, the only way to satisfy it is through EPrescribe. When you attest, they will ask you, have you enabled this functionality? If you have EPrescribe, you're going to say yes. For core objective number 3, maintain a problem list. Now this will be done in the problem list subtab of the health tab. You may also enter this in the patient profile. There is a health tab in there as well. Now this must be done with 80% of all your patients seen within the 90-day reporting period. In order to satisfy this, you must at least have one active problem documented in the problem list. And if there are no known problems or they have no problems, then you must check the checkbox No Known Problems. Core objective number 4 is EPrescribing. In order to satisfy this objective, you must have EPrescribe. Now, there is an exclusion for those doctors who write fewer than 100 prescriptions during the 90-day reporting period. Any prescriptions that you will be prescribing to the patient must be done through EPrescribe. Core objective number 5, active medication list. Now, this is very similar to core objective number 3. This is done in the medication subtab of the health tab. You must at least have one documented medication that the core objective number 5, active medication list. Now this is very similar to core objective number 3, active problem list. You must have one active medication documented in the medication list of the health tab. Or if there are no known medications, or if they are not taking any medications, then you must check the No Known Medication checkbox. For core objective number 6, medication allergy, if they have one active medication allergy, you must document this in the allergy subtab of the health tab. If there are no known medication allergy, or if there are no medication allergy, then you must check the checkbox for no known allergies. Core objective number 7, record demographics. Now this is done in the patient profile. If you are on the latest build of My Vision Express, you'll notice that in the patient profile, there are sections that are highlighted in a seafoam green color. This will indicate that this has to do with meaningful use and that you must add information in those highlighted sections. This will also be seen throughout the examination. Now for this objective, they are looking at preferred language, gender, race, ethnicity, and date of birth. All of this information must be documented within the patient profile. This must be done with 50% of all unique patients who have an exam. Core objective number 8, record vital signs. Now, this objective is kind of controversial because I see that it's a half and half with this one. Half the doctors feel like this is something that is necessary. The other half don't feel like it relates to their scope of practice. This is entirely up to your practice. You can exclude yourself from it. The exclusion is if you feel like this has no relevance to your scope of practice. Now, my only 2 cents on this is that if you are satisfying this objective, you're also helping yourself with the clinical quality measures, which 2 of those objectives or 2 of those measures are actually looking for blood pressure and weight. You can ask the patient what their weight and their height is. The only thing that you would have to do extra is the blood pressure. This must be done with 50% of all the patients who have an examination during the reporting period. Core objective number 9, record smoking status. Now you may document this in the patient demographics as well. It is also highlighted in that seafoam green color. You will have to record the smoking status for any patients 13 years and older. If you are documenting this information, you are also aiding yourself with clinical quality measures. One of them will be asking for smoking status and also tobacco cessation. Core objective number 10, clinical quality measures. As I just mentioned before, there are additional measures that you must attest to. There will be 6 of them. There are 3 core measures as well as 3 alternates. Now I'm going to switch out of the PowerPoint so that I may show you within My Vision Express what these 6 objectives are, or measurements I should call them. So in this report, you can see your 3 core measurements. The first one is adult weight screening and follow-up. This is looking at any patient 18 years and older with a calculated BMI in the past 6 months or during the current visit documented in the medical record, and if the most recent BMI is outside parameters, a follow-up plan is documented. The second one is hypertension, blood pressure measurement. This is also looking at patients who are 18 years and older, but with a diagnosis of hypertension and who have been seen for at least 2 office visits with the blood pressures recorded. Then the last core measure is the preventative care and screening pair. Now this is split into 2 numerators. The first one is tobacco use assessment. So this is when you would be documenting if they are a tobacco user, if they're smoking. And the second one is tobacco cessation intervention. Now I'm going to kind of segue as well and go into my examination. Now as far as the BMI and the counseling or plan documented, you do have your counseling section here in your social history. So if it is outside the parameters, you do have the nutrition and physical activity checkbox here. For those tobacco users, you do have tobacco cessation here to check off. Going back to our report, now I'm going to go into the alternates. Now these are diagnosis that the doctors should keep in mind. So the first one, primary open-angle glaucoma. This is looking at any patients 18 years and older with this diagnosis and who have been seen at least twice within the reporting period. The second one, these are both very similar, diabetic retinopathy. So it is looking at anyone 18 years and older with a diagnosis of diabetic retinopathy and have had a dilated macular or fundus exam performed. You may do this in the internal tab by checking off the dilation box. And the last one is diabetes eye exam. This is looking at any patient 18 years old through 75 years of age with the diagnosis diabetes or diabetic in the problem and who have had a dilated macular or fundus exam. Now with clinical quality measures, you can attest to 0 out of 0, but you must attest to 6 measurements. They're not looking at a certain percentage, they just want to see you reporting what these numbers may be, whether it's 0 out of 0 or if there is an actual numerator and a denominator. The next objective will be core objective number 11, clinical decision support rules. So you must implement at least one clinical decision support rule. The way that you can do this is through My Vision Express if you go to File, Setup, Exam, and Alerts. So you're going to go to File, Setup, Exam, and Alerts. Now in order to satisfy this measurement, you only need at least one that is set up. Now I have here the example of high cardiovascular risk. I'm going to add another one just to show you how to do this. So for this example, I'm going to use glaucoma. The message that I want to appear is check intraocular pressures, and I'm going to choose an age range. I'm going to have anyone over 40. You may also choose an ethnicity and a race. Now I want something to trigger this message. So I'm going to go to Details. Now I'm going to add either a diagnosis, a medication, or a laboratory test result in order for this message to appear. These tabs will appear in your Health tab. So for this example, I'm going to use the diagnosis glaucoma suspect. The way that this is set up now, if I have a patient and I enter in that problem list 365.00, the message will appear check IOP. As long as I have this set up, you will be satisfying this requirement. Core objective number 12, electronic copy of health information. Now this objective asks that you provide patients with an electronic copy of their health information. This is including diagnostic test results, problem lists, medication lists, and medication allergies upon request. This will come in the form of the continuity of care document. This must be done with more than 50% of all patients who request an electronic copy of their health information and are provided with it within 3 business days. The exclusion is if you have no patients who request this information. In order to satisfy this objective, you would have to go into the HL7 CCD CCR subtab of the Health tab. You would then have to generate a CCD and then you may upload it to Health Vault. This will give the patient access to this information. For core objective number 13, clinical summaries, this is asking that you provide clinical summaries for patients for each office visit. Now, an office visit is defined that anytime a patient is sitting in your chair, whether it is a follow-up or a full exam, it is considered an office visit. Now, this is looking for these clinical summaries to be provided to the patient for more than 50% of all office visits within 3 business days. So this is a measurement which you must get into the habit of after the patient is seen, try and print or email these clinical summaries or even at the end of the day. In order to satisfy this objective within My Vision Express, I'm going to go into an examination. In order to satisfy this within My Vision Express, you're going to go to your examination and then you're going to go to letters. You're going to either print out or email any letter that says exam summary. In order to satisfy this within My Vision Express, this letter must say exam summary in it. Now we do have a 1-page document. It used to be the glance letter, but it contained everything that we needed, which was pretty much the assessment and the plan. And this exam summary towards the bottom, now this is the longer version of it, so you do have the choice. If you wanted to include this one, you may, or if you prefer the 1-page one, you may use that as well. You may also create your own letter if you wished, and then just add exam summary as the title. Core objective number 14, electronic exchange of clinical information. This asks that you perform at least one test of certified EHR technology's capacity to electronically exchange key clinical information. The way that you can achieve this within My Vision Express is that you would generate a CCD which will contain that clinical information. Now you can do one of 3 things. You could either email, you could fax, or you could even export the CCD to another physician. Now, if you were to email or fax or even export this information to another physician, I would only make sure that you have proof of it. So if you were to email this to another physician, I would keep that email as proof. If you were to fax it to the other physician, then I would keep that fax for yourself as proof. It is kind of hard to show proof if you're just exporting it onto a USB drive, so that's why I would recommend either faxing it or I would email this information to the other physician because it is physical proof that you've done it. For core objective number 15, protect electronic health information, this asks that you conduct or review a security risk analysis in accordance with the requirements under 45 CFR 164.308A1 and implement security updates as necessary and correct identified security deficiencies as part of its risk management process. Now you have one of two ways that you can achieve this objective. The Security Risk Analysis reference on Objective 15 is mandated by the HIPAA and HITECH Act and must be done in compliance with 45 CFR 164.308A1. This is a fairly complex requirement, and we strongly recommend that you get help from your HIT Regional Extension Center to comply with it. This link will actually send you to this website, and you would just choose the state that you live in and navigate through the website so that you may achieve the security risk analysis. Some of them are free. I think I saw in California that there was a free version of it, but they may charge you, I believe it may be up to $300. Now, if you were to decide to perform the risk analysis on your own, we have put together the following document to help you with it. Now, I do warn you that this document is rather lengthy. It's about 40 pages long, but it will help you with performing the risk analysis. You are able to find this in our support center under meaningful use. It should be in the in number 15 of our tutorial videos. There is a link below the video for core objective number 15. Now with our menu set, so there are 10 objectives in the menu set. You only have to satisfy 5 of them. The ones that I recommend goes as follows. The first one is the drug formulary check. If you have EPrescribe, this is something that has been enabled, much like core objective number 2. The exclusion is if you write less than 100 prescriptions. Now, if you were to choose to exclude yourself from this one, it will still count as part of your 5. Menu set number 2, clinical lab test results. This also is another exclusion that you are able to take and have part as your 5. If you order no lab tests whose results are either in a positive or negative or numeric format during the EHR reporting period, then you are excluded. Menu set number 3, patient lists. The objective is to generate lists of patient by specific condition to use for quality improvement, reduction of disparities, research, or outreach. Now, in order to satisfy this using My Vision Express, you may go to File and Letters. You would then go to your Search tab and click on Extended Search. What I'm going to do next is that I'm going to add a diagnosis which I think patients may have. I'm going to use glaucoma as an example. Then I'm going to go ahead and hit search, and what should happen is a list below will generate. I only have one person here, but a list of patients should generate who may have that specific condition or may be taking that medication. If you look at your extended search button one more time, you'll see that there are certain tabs. So you can choose a problem, you can choose a medication, a laboratory test result, an allergy, immunization, or even an order. So long as you generate this list and keep it for your own records, you will satisfy this requirement. When you attest, it's going to ask you, have you done this? Yes or no, and you will say yes. The fourth menu set is patient reminders. Now this is a small percentage, it's only 20%, and it's looking at patients 65 years and older or 5 years and younger. The reason why I like this is because it's something that practices are probably doing already, sending reminders or sending recalls or printing out letters for these patients. Also, it's a very small percentage. It is an objective that's fairly easy to achieve. So those are the first 4 that I would recommend. Now your 5th objective would have to be either number 9 or number 10, which is immunizations or syndromic surveillance. I would recommend number 9 because it is something that you can exclude yourself from and it'll still count as part of your 5. Now, for any reason, if you choose to attest to another objective, the next one would be objective number 5, patient electronic access. This is providing patients with timely electronic access to their health information. This is once again in the format of a CCD. This must be done within 4 business days of the information being available. This also is a small percentage, it's only 10%. Now, in order to satisfy this in My Vision Express, you would just generate that CCD and then you would just upload that to Health Vault. Number 6, patient-specific education resources. This is providing patients with educational material and documenting it within My Vision Express. This is a very small percentage, it's only 10%. Now, in order to satisfy this in My Vision Express, you may go to your Health tab, and there will be 2 sections where you can provide education. The first one being in your problem list, you will click on education, and you can either set it up in education resources, or you can physically hand them a pamphlet or providing them with some type of education, and then checking on the education provided checkbox. This may be done in the problem list, medication tab, or you may do this in the assessment tab. Now, the only thing that I will say about this specific one is that I am a person who likes proof, so if you are physically handing this information to the patient and it's not set up within My Vision Express, it is rather hard to prove that you've done it other than that checkbox. If you were to physically hand them this education, I would somehow document it, whether it's in the interactions or in a note section of the exam. Number 7 is medication reconciliation. This is if a doctor receives a patient from another setting of care or provider of care or believes an encounter is relevant and should perform medication reconciliation. Number 7 is medication reconciliation. This is when the doctor receives a patient from another setting of care or provider of care or believes an encounter is relevant and should perform medication reconciliation. This must be done to 50% of transition of care in which a patient is transitioned into the care of the doctor. The exclusion is if you were not the recipient of any transition of care during the reporting period. In order to document this, you would have to go to the patient profile and you would go to your demographics tab. And you would just document over here in your referral type and then you would just document the referral in this section. Now, number 8 will be the opposite, transition of care summary. This is any doctor who transitions their patient to another setting of care. Now, in order to satisfy this, in your assessment tab, towards the bottom, there will be a referral and then in order to satisfy this using My Vision Express, you would go to your assessment tab and you would document the referred to and the reason. You would then either generate a CCD and provide that CCD to the outside physician, or you can go to your letters and you can either email or print out a letter with the name referral in it. The next one will be menu objective number 9, immunization registries data submission. Now, you must attest to either number 9 or 10. As I mentioned before, I would attest to number 9 because you can exclude yourself from it and it will still count as part of your 5. Menu set objective number 9, immunization registries data submission. Now, this is a measurement that you can exclude yourself from. Menu set number 9, menu objective number 9, immunization registries data submission. Now, you may exclude yourself from this. If you administer no immunizations, you are excluded. You must attest to either number 9 or number 10. I would suggest number 9 because it's something that you will never do. Number 10, syndromic surveillance data submission. Now, this is asking that you performed at least one test of certified EHR technology's capacity to provide electronic syndromic surveillance data to public health agencies and follow-up submission if the test is successful. Now, the exclusion is if you do not collect any reportable syndromic information on your patients during the reporting period. You may also exclude yourself from this if it applies. So that is all 25 objectives and how to do it within My Vision Express. Now, the next thing that I would like to show you, or the last 2 things that I would like to show you, is our checklist. It is something that I do highly recommend that physicians get in the habit of doing, especially if... Now, the last 2 things that I'm going to show you is within My Vision Express, it's 2 new features that we have. If you are in the one... Now, to finish up, I'm going to show you 2 last things. The first one is going to be our checklist. This is found in the examination. Now, the last 2 things that I'm going to show you is Now I'm going to show Now to wrap up, I'm going to show you two last things. The first one is going to be your checklist. This is found in the examination. Now, I highly recommend that doctors get into the habit of checking this checklist after each examination. This will make it easier on you during the last 90 days of the report. Now, I do highly recommend checking this checklist after each examination. This will make it a lot easier to make sure that you're satisfying each objective. Now, you'll find it up here in the seafoam green color with a little wand. And when you click on it, you'll be able to see all 25 objectives. You'll also see these check marks and red X's. The red X's will indicate that you have not satisfied this requirement. So for the example of core objective number 5, maintain active medication list, I have an X, so that means I did not satisfy this requirement. This will give you the chance while you are still in the examination to add this missing information or to do a task that you have not done yet. The last thing that I'm going to show you is our meaningful use report. If you go to File, Report, and Meaningful Use, you'll see all 15 core objectives. Then you'll have a tab so you can choose the 5 menu items that you'd like to attest to. And then you have your Clinical Quality Measure tab. You would check your 3 core and your 3 alternates. You would then choose your physician and the date range, and then you would run the report. This is something that you're going to be doing at the end of the 90-day reporting period. As you go through each line on the bottom here, you're going to see which ones you are excluding yourself from. So for the example of core objective number 1, CPOE, the exclusion is if you write less than 100 prescriptions. If you happen to write less than 100 prescriptions and want to exclude yourself, you'll check on the checkbox, and then you'll move on to the next line. So for core objective number 2, drug interaction checks, this is going to be a yes or no question. If you have EPrescribe, then you have enabled this functionality. Then you'll click on the checkbox for attestation. This will ask if you have met the attestation requirements as defined in the browser above. If you have EPrescribe or if you've satisfied this requirement, you'll say yes, and you'll notice that the check mark is now checked. And you'll notice now that there is a green check mark. So you'll go down the list for both attestation and exclusion. You'll look at your numerators and your denominators, your percentages, and your target, and if you've passed or failed each one. Then when it's time to attest, you're going to click on print, and then you'll be able to print the sheet out so that during the attestation, you can just go line by line and either say yes, no, exclude yourself, or plug in. That way, when it's time to attest, you can go line by line and add which ones you are excluding yourself from, which one is the yes or no questions, the numerators, and the denominators. So what do you need to do to prepare for next week? I would make sure that all relevant setup is complete. So your OIDs, your health vault, make sure that you're signed up with EPrescribe. I would set up my alerts, make sure that you have a good exam summary letter. I would have all my outside physicians documented, and even education resources if that's a menu item you'd like to attest to. I would also highly recommend using your Meaningful Use Wizard. It is honestly the best tool that you can have to just ensure that you are satisfying all of your objectives. Towards the end, and then what do you need to do towards the end of the reporting period? Make sure that you have performed at least one electronic exchange of information. Make sure that you have done that security analysis risk, and do make sure that you have that patient list in the... What do you need to do towards the end of the reporting period? I would make sure that you have performed at least one electronic exchange of health information, which is a core item. I would make sure that you have done the security risk analysis, which is another core item. And then I would make sure that if you were to choose to do this menu item, I would make sure I have that patient list. I would also use the attestation calculator. There is a link here. There is also a link in our Meaningful Use Support Center, so that way you can actually see what the attestation will look like. It will let you know if you have passed or failed. This attestation calculator will help you prepare for when you attest. It'll give you an idea of what each question will be asking, how it'll look like, and also if you'll be passing or failing. I do thank you for attending. Please let me know if you need further information or if you would still like to schedule a training session. You will contact me. My phone number is 877-882-7456, extension 713, or you can email me at denise@myvisionexpress.com. And now I will go ahead and answer any questions that you may have.